Thank you for taking time to view this presentation focused on the Sustainable Cardiopulmonary Rehabilitation Services in the Home Act. We will be providing information to assist preparation for your congressional meetings during AACVPR's Day on the Hill. The House bill is H.R. 783 and the Senate bill is S. 248. You don't need to worry about remembering the bill numbers. You will have an issue brief to share with congressional offices providing that information. The legislation is bipartisan and was introduced in the House of Representatives by Representative John Joyce, a physician from Pennsylvania, and Scott Peters from California. The Senate bill was introduced by Senators Marsha Blackburn from Tennessee and Amy Klobuchar from Minnesota. Your request for members of Congress is to ask that they co-sponsor the legislation and advance the bill. As mentioned earlier, you will have an issue brief that you'll leave with offices you meet with. The issue brief includes key information most offices look for. It states the ask, provides a brief summary of the bill, background information, a list of supporting organizations, and lets them know who to contact if they are able to sign on as a co-sponsor. The legislation has two key components. First, it would permanently allow Medicare patients to receive cardiopulmonary rehab services via virtual telecommunications in a beneficiary's home. Second, it would allow virtual direct supervision through two-way audiovisual communications technology. Telehealth flexibilities were enacted during the COVID-19 public health emergency. As the end of the PHE approached, Congress acted to prevent a sharp cutoff of these services and to ensure more certainty. The PHE ended in May of 2023, ceasing virtual delivery of cardiopulmonary rehabilitation services by hospital outpatient departments. Congress acted to extend telehealth flexibilities, and currently they're set to expire on March 31st. However, the telehealth extension only applies to cardiac and pulmonary services in physician offices, which account for less than 5% of total cardiopulmonary rehab care. As the March 31st deadline approaches, Congress is again looking to revisit extending telehealth flexibilities. Therefore, as we'll discuss in a moment, it's timely to remind Congress of the requests specific to cardiopulmonary rehab. This legislation almost became law in December as part of congressional efforts to extend the broader telehealth legislation. The bill had a committee hearing. It was passed with strong bipartisan support in the Health Subcommittee. Then it was incorporated into a larger telehealth package, which was unanimously passed by the House Energy and Commerce Committee last fall. At the end of last year, the telehealth and the virtual cardiopulmonary provisions were included in a bipartisan funding package. Unfortunately, before passage, the package was significantly narrowed, resulting in only a 3-month extension of existing telehealth flexibilities. The bill sponsors continue to push for this legislation to be included in any telehealth package considered by Congress. Before your meetings, you'll want to know whether the office you are meeting with already supports the legislation. In your folder, you will have a co-sponsor chart, a sample of which is shown on the slide. The information is organized by state, and the first column shows only those members of Congress who have taken action to support the bill. So if you don't see your state, your senators, or your representative, it means they have not co-sponsored the bill yet, and you want to ask them to do so. The second column, where you see the blue arrow, identifies co-sponsors of the legislation. The column is split into two parts. The left side shows if they are co-sponsor of the bill introduced this Congress, which started on January, the 119th Congress. The right side shows that they've co-sponsored the bill last Congress, the 118th Congress. For example, on the slide, you'll see that Representative Mike Rogers from Alabama co-sponsored the bill last Congress, but has not yet co-sponsored the same bill this Congress. So in this case, you would want to thank him for supporting the bill last Congress and ask him to again co-sponsor the bill this year. In your meetings, you are not expected to be a policy expert. Rather, you are there to share your expertise and personal experience to explain why policy changes are needed. You'll want to provide some background on what cardiopulmonary rehab is, why it's important to the Medicare population, and the need to make these services more accessible. To support your efforts, you'll have a folder to leave behind with information on cardiopulmonary services, the map of rehab service deserts, and key information related to the legislation. However, stories are powerful and are remembered long after your meetings. Before your meetings, think about personal stories that demonstrate the need for congressional action. If you don't have a personal story, feel free to share a story from a colleague or a patient. Also, if a question comes up during your meetings that you're unsure how to answer, it's okay to tell them you or someone from ACVPR will get back to them. Congressional offices like to know if legislation is supported by more than one organization. This bill is supported by more than 35 patient and provider groups, health systems, and industry organizations. This information is included in the issue brief you'll leave with the offices, and some of the patient and provider groups are listed on this slide. Before you conclude your meeting, don't forget your ask. Congressional offices expect an ask, and it's helpful to start and end a conversation about a bill with it. Again, your ask is for them to co-sponsor the bill, and if they've already co-sponsored the bill, please thank them and ask for their help to advance the bill. After your meetings, please take a few minutes to provide feedback about the meeting. It's helpful for ACVPR to know if an office told you that they will support the bill or if they have questions that would benefit from additional follow-up. Please use the feedback form in your participant folder. You can fill out the hard copy or use your device to scan the QR code and respond electronically. Thank you for taking time to review this information in advance of your congressional meetings. If you have any questions, please email advocacy@acvpr.org. Have a great day on the Hill.